Hello, my name is Dr. Asley. I'm a board-certified fellowship-trained spine surgeon. I'm the medical director here in Spine Treatment Center. In this segment, I'll be discussing with you a surgery called posterior cervical fusion. Let me brush you up in the anatomy a little bit. This is a model for cervical spine. As you can see, there are 7 vertebrae that are stacked up on top of each other. This is the front, this is the back. In the other section, I discussed with you anterior cervical fusion, which is basically going through an incision about this much right here in either right or left side of the neck. And then after that, you're not really cutting anything. You're spreading structures and you're looking right down to the spine. You take the disc out and fuse the 2 vertebrae. If, for some reason, part of the biology, the bone doesn't heal and you end up with a non-union, then we have to do a posterior fusion to get that area to heal. In terms of the posterior fusion, when the patient comes in for surgery, they get intubated and we put them to sleep, and then they get secured into their skull a C-clamp we call a crown of thorn, which has 3 spikes that secure the head, and they have a clamp that connects to the table, and that's how we secure the head and we can do the surgery. So if the patient wakes up and has some bleeding in the skull, they understand what happened. Once that happens, we make an incision about 6 centimeters right over the surgical area, and we dissect the muscle off the bone. Then you're directly looking at the cervical spine. We do these surgeries mostly for 2 reasons. One, if the spinal cord is being pinched and what is pinching him is in the back, then at that point we'll need a procedure called laminectomy, which is basically unroofing the canal. You take the lamina on both sides and you remove it so the spinal cord can breathe. Or if you're doing this surgery for a non-union, if you've had an anterior cervical fusion and it didn't heal, then you have to bring him back and fuse him from the back. And in that segment, you put screws in these lateral masses and connect them with rods on either one side or the both sides, depending on the pathology, and that's the fusion. Risks with this surgery, of course, is every time you make an incision, you can have an infection. Chance of infection in the cervical spine is very, very low. I haven't had it in my practice. Nerve damage, after all, you are operating over the spinal cord. Chance of that complication is very low. Of course, the other complication is that another non-union. Every time you try to fuse the 2 bones, there is a chance that it might not heal. Chance of non-union in the posterior fusion is very, very low. I haven't seen it in my practice. So my union rate in my practice for the posterior cervical fusion is pretty good. However, still, it's not guaranteed that it's going to fuse. So there is a chance for a non-union in the posterior cervical spine fusion as well. Of course, the most important thing about the surgery is the damage that this surgery can cause to the muscles. After this, you have to dissect the muscles off the bone. That's why when I suggest this surgeries to my patients, it's absolutely necessary. I personally do not like this approach because I believe that I can do most of the work that I need to do from the front, which is a minimally invasive surgery. However, if you have to address a problem and we have to address it from back, we have to do that. However, I haven't had any patients that linger with pain for a long extended period of time. They're kind of uncomfortable for the first month. So it takes about a month for the patients to get comfortable. But then after that, if you address the primary issue, which is a non-union or a spinal cord, they get comfortable. And that is a fusion. So the complications are low. Chance of healing is high. But of course, we want to minimize the damage to the muscle. And the most important thing I want you to realize that if I have suggested this surgery to my patients, it's absolutely necessary that we have to do it. I hope you enjoyed this segment and have a nice day.